Want to know more about canine arthritis and how to manage it? Then you're in the right place. A great extra resource that you can check out is Canine Arthritis Management. They've got tons of information, but we'll go over the basics here. So what is arthritis? Arthritis is the end stage of degenerative joint disease. So this is where the cartilage that sits at the end of all your long bones in your dog's body starts to wear away. This leads the underneath bone to become exposed. So as the cartilage wears away and this bone underneath becomes exposed, that means that all of the nerves that sit within that bone are also exposed. This is why our dogs with arthritis have pain in their joints. So unlike cartilage, bones do have nerves and they feel pain, but the cartilage doesn't. This is why our dogs can move absolutely fine when they have a good covering of cartilage on the end of their bones, but when they've developed arthritis and they no longer have this cartilage covering, it causes pain. The cartilage also helps the bones to move easily over one another. So when this cartilage is reduced, it's much harder for the bones to move against each other, which means that they have reduced movement in that joint. So what are the signs of arthritis in our dogs? Slowing down, which can often be mistaken for old age, reluctance to go for walks, or wanting shorter walks, or appearing stiff or limping during or after walks. This is a sign that your dog's in pain and doesn't want to walk on the affected limb. Some signs and symptoms you might see that are linked to pain also include changes in behaviour, appetite, and a reluctance to be touched or to be part of the family as they usually would. This can manifest itself as wanting to run around lots and trying to stay out of your way, or the opposite, lots of sleeping and not really being present. So what treatments are there? So there's tons of treatments, luckily, for arthritis, although there is no cure. Once arthritis has begun, it is degenerative and it does get worse over time. But there are some things we can do to help reduce the severity of this and to help slow down the progression. So we can look at pain medications to help with that pain. These are prescribed by your vet and come in either a tablet or liquid form, or you can get them injected. You have physiotherapy and hydrotherapy to help improve your dog's functional movement. This increases the joint movement and reduces pain. Modalities that may be used can include laser to reduce joint deterioration, massage to reduce any muscle tension and pain associated with not being able to move that joint as well, swimming or walking on an underwater treadmill to encourage joint range of motion without any weight bearing, which can cause pain, and hydrotherapy also helps along with your rehab exercises to build muscle and strength, helping to support your dog's joints, which means that they're less unstable and less likely to move where they shouldn't and therefore cause any additional wear or rubbing on that cartilage. Some supplements that have been suggested to help are fish oils, green lip mussels, curcumoids, glucosamine and chondroitin. When you visit your vet for a diagnosis of arthritis, you can discuss all of these options with them. And you can also check out the Canine Arthritis Management website for any more information regarding these. How can I prevent arthritis? What changes can I make at home? So a few simple changes that you can make at home, whether your dog has arthritis or not, is covering all slippy floors with rugs and carpets and ensuring that your dogs don't run on these floors. Using ramps on and off of furniture and in and out of the car to prevent jumping, especially in smaller dogs. If you have a giant breed that can just step onto the couch, then that's quite handy. Raised food and water bowl for larger dogs so they don't have to stoop down. This is particularly important if your dogs do have arthritis. Ensure they have a comfy orthopedic bed that doesn't lead to any pressure sores, especially if they're reducing their exercise and are wanting to sleep more. Reducing their exercise, especially at high impact exercises, such as anything that involves throwing balls or sporting activities. These really should be kept to a minimum because they do unfortunately increase our dog's chance of getting arthritis just because of their high impact nature. They put more stress on the joints, meaning that cartilage has to work harder and therefore gets worn away quicker. So I hope that has helped you to understand a little bit more about canine arthritis. And like I've said, please do visit the Canine Arthritis Management website for any more tips.